Basically, the healthy gut bacteria that we talked about earlier that live primarily in our gut, but they're in other parts of the body as well. Anywhere you have an opening in your body, you actually have a healthy gut colony. All right. These bacteria in our gut, they serve a role. For example, when we feed our gut bacteria dietary fiber or polyphenols from our foods, that's the food they want. Like our gut bacteria is like our pet. Do you have a pet dog or a cat or a bird?
Yeah.
Okay.
Golden retriever. Yeah.
Okay, you got a retriever. All right. So look, you wouldn't think, you don't have to think twice about feeding your dog. You just do it as a matter of instinct, right? You're going to take care of your golden. All right. Guess what? We actually do the same thing to our gut microbiome. When we're eating foods, we're feeding ourselves, our human body, our human cells. We're also feeding our gut bacteria. Now, you probably would be appalled if somebody who was dog sitting fed your golden like trash, something horrible, right? But you know what? When we actually eat junk food, ultra processed food, additives, all right, we're actually feeding our gut microbiome, our pets, something really bad. So when we damage our gut microbiome, the things that they normally do to protect our health suffer. One of the things they do, normally lowers inflammation. So if you damage your gut microbiome, inflammation rises. Okay, it's like a flood. It just kind of like wells up and spills over. Now you got inflammation everywhere. You want to talk about one force that can trigger cancers to grow fast? That turbocharging you were talking about, it's going to be inflammation. So you got to keep your gut really, really calm in terms of let your gut do the work for us. The other thing that our gut does is it primes our immune system. 70% of our immune system actually lives inside the walls of our gut. All right, so our gut bacteria talks to our immune system. And listen, after 2020, everybody knows how important the immune system actually is. But our gut bacteria talks through the wall of the gut to our immune system. So people go, well, I can't picture that. All right, picture this: you're a freshman in college, you're in a college dorm, you got a roommate, you're in a room, you got a roommate next door, and you got a really thin wall. What do you guys do? When you're a freshman, you yell through the wall at your roommate, "Hey, what do you want for pizza? What do you want on your pizza?" And they can yell back at you. And this is exactly how the gut bacteria and immune system talk to each other through the wall of your gut. And so when your gut is actually healthy, well-fed with polyphenols, dietary fiber, it will talk nicely to your immune system and tell your immune system what to do. Strong immune system, you can actually fight invaders from the outside of the body as well as invaders from the inside of the body, i.e. cancer cells. Those drug dealers sitting on the street corner in a suburban neighborhood, right? That's the microscopic cancer. You want your immune system to be really strong to be able to do that. So this is actually one of the importance of the gut microbiome. Now, I'll tell you, the gut microbiome also helps to smooth out our metabolism. It helps us heal well, makes our cells more sensitive to insulin, so we can actually regulate our blood glucose better. And our gut bacteria, by the way, text messages our brain. So one of the biggest nerves in our brain, called the vagus nerve, comes pounding out of the brain and goes right down to our gut, and it fans out. The nerves fan out like the tail of a horse. Okay, like the end tail of a horse in a wind. So lots of little fibers. That's what the vagus nerve does. And guess what? The gut bacteria send SMS signals up and down that channel, the communication channel, back to the brain. All right. Now, recently, this is like a stunning new discovery. I mean, I'm talking about within the last 6 months, they have discovered that the brain has its own microbiome.
Wow.
That's like stunning to think about. And about 20% of the bacteria in your brain, healthy bacteria in the brain, your brain isn't infected, it's healthy. 20% of the brain bacteria are the ones that are also found in the gut. So clearly, these are relatives that are actually working together.
Yeah. Yeah. And then, a lot of people don't realize that, even some over-the-counter medications and stuff, there's so many things that are microbiome like modifiers that are affecting you. And one of the downsides of taking something like a antacid for a really long period of time is like the way that that's modifying your microbiome. And then, so a lot of the intersection between some of the pharma drugs that are aimed at helping you with a specific issue, then I'll end up altering like the microbiome. And so that's like another thing that people
Sure. I'll tell you, there was a stunning research paper that was published in the journal Nature that looked at the connection between antibiotics, which are designed to kill bacteria, and breast cancer survival. Okay. And they found in a large population of women that the more rounds of antibiotics they got, the worse their survival is. Now, remember I told you the gut microbiome is actually responsible for lowering inflammation and boosting your immune system. And so, I think it was sort of like from no exposure to antibiotics, you had, reasonable survival. Then you went to like 8 different types of antibiotics over time. The survival just started to chunk down. You really dropped it. That said, let's not forget that when their gut bacteria have overgrowth of harmful bacteria, one of them is called C. difficile. Okay, that can actually kill you if you have like too many bad bugs growing. So sometimes you want to give it antibiotic that can be life-saving to reset. You want to weed out some of the bad guys, and sometimes you need an antibiotic for that as well.
Yeah.
So again, these are this is why
this is like we were talking about at the beginning, the nuance of
it's the ecosystem.
Yeah.
It's it's the functional aspect of it. Everyone who thinks about health wants like the black and white, the on and off switch, the magic bullet. But I would say, our health is more like conducting a symphony. You got a lot of violins, you got drums, you got trombones, you got, cellos. You have to get everything to work the right way. And guess what? Who would have thunk that you could actually direct Beethoven's symphony? It's beautiful, but it does require skill at lots of different levels.
Hey there. Have you heard of intermittent fasting? I'm sure you have. It's not what you eat, but it's about when you eat. And I've got a simple guide to help you get started with intermittent fasting. If you're looking for an easy way to boost your energy and improve your health, and maybe shed a few pounds along the way, this could be the perfect solution for you. In my guide, I'm going to show you how fasting helps your body burn fat and also repair itself. It's an easy thing that you can do effortlessly every single day. Plus, I'll give you tips on how to succeed with intermittent fasting. And I'll tell you the science behind why this works. Just click the link below to grab your free copy, or scan the QR code on the screen right now. Now, let's get back to the video.
The single biggest breakthrough in cancer treatment in the last 100 years, hands down, is immunotherapy. These are treatments that are not chemo. Don't make a mistake, it's not chemo. These treatments wake up your own immune system. And as we talked about earlier, your own immune system is responsible for wiping out cancer all throughout your life. So you're just supercharging, revving up your immune system to go search out and destroy cancers. Now, this was kind of immunotherapy was sort of a pipe dream for many, many years, for decades. People have been looking for this. And then finally, about 10 years ago, 15 years ago, it became reality, like breakthrough by the biopharmaceutical company, biotech companies. We have immunotherapies and they work. They have been FDA approved. So anybody who's cancer should be having a conversation with their doctor. All right. Can I be treated with immunotherapy? That's a question every single cancer patient should ask their doctor. All right. That's advocacy. And by the way, before you ask your doctor there, you might want to go onto Google, okay, and look up immunotherapy and type in, search for the type of cancer you have to see if there's anything that's already approved, because you're not testing your doctor, but then you're loading up your own knowledge. And, oh, wait a minute, there are some studies that show that this can be used for my type of cancer. And that way, if your doctor says, nah, not for you, not going to work for you, say, I beg to differ. I looked up this research article and I can tell you that it is being used, or it has been used, or it has been successful. That's advocacy as well. I mean, there's a lot of downsides to having too much information, But when it comes to doing your own research, I do think that preparing for a medical visit, this is an area that would be useful. So immunotherapy is a big breakthrough. Targeted therapies, you find the mutation, you hit the target, you cut off the blood supply to cancer. These are all breakthroughs that are not chemo. They actually, and not radiation and not surgery. These are the new generation of cancer treatments. But I want to say one thing about cancer treatment that I was asked to give a keynote in England last year to talk about, the transformation of cancer treatments. And what I presented was that, when we think about what happens, the goals that oncologists have to treat cancer, it's destroying the cancer, killing the cancer, burning it out, poisoning the cancer, and and using chemo, and that entire vernacular, the language, the vocabulary, the war against cancer, everything is really aggressive and scary. All right, it's violent. Is because where chemotherapy came from?
Where?
Came after during World War II. There was a secret mission to bring mustard gas to try to attack the Germans. So the U.S. actually snuck a battleship there against the Geneva Convention. All right, so this is the U.S. government way back when. They put it like in a ship that shouldn't be carrying weapons. The Germans heard about it, intelligence leak. They flew planes over, bombed the ship. They didn't know it was mustard gas, but there was mustard gas in it. And the mustard gas came out in Bari, Italy, and poisoned a ton of people. But they found that some cancer patients actually survived. All right, and that was the birth of chemotherapy with mustard gas, and that's why all of this cancer. The verbiage that we use with cancer therapy is around war, destroy, burn, kill. All right. Now it's different. Now we're using the biological aspect, the functional aspect of cancer therapy. We are moving away from killing the cancer, which usually doesn't work, right? Very long. It might work for a little while, but usually the cancer will come back and kill you. All right. We're moving away from killing the cancer to healing the person, taking a more global, integrated, functional approach, including immune therapy, supporting the microenvironment, getting gut to be healthy with medicines, but also with diet and lifestyle. So back to, what you were talking about at the very beginning, we'll stick the landing on this thing, right back to the beginning, which is what's the advantage, the difference between conventional old school medicine, which is all based on writing prescriptions and doing surgery, versus the functional holistic. I would say that cancer as a field, oncology is a field where we are rapidly making strides to move away from the past, which was based on killing something, to healing something. And if you want to actually be healthy, you want to focus on healing and focus on health. That's really where the name of the game is when it comes to health and wellness.
Do you feel like that's the difference between, I think some people are so concerned that there's a lot of people who had cancer. I don't know if they went through chemotherapy or something else. They got rid of the cancer, and then 2 years later, the cancer's back, and they do it again. They got rid of the cancer's back. And so, how is it that somebody has quote unquote no evidence of disease, with their cancer, and then all of a sudden it comes back? What's happening in the body there, and do what you're talking about relate to that in terms of the way we go about trying to...
I mean, look, we could do an entire podcast on the biology of cancer and cancer recurrence. Yeah. But the bottom line is that most killing of cancer cells in one spot, you haven't really wiped them all out. They're still floating around someplace. There's these little what's the right word? Sleeper cells, like little terrorists that are hiding out. Some of them will eventually wake up, and it's called recurrence. But that's just relying on the drug to kill the cancer to begin with. If you actually boost your immune system, you train your immune system, and now your immune system is just doing patrols, okay, you're more likely to get a durable response. Now, immunotherapy doesn't do the trick for everyone, but we're seeing it happen more and more. And so we're going from the first case to a few cases to more cases, and researchers are doing gangbuster style research to try to figure out how to make immunotherapy work for more people.
That's it. That's really good. Last question. I mean, I felt like I really wanted to ask this because it's become a hot topic. I don't know if you're familiar with Walter Longo's work. You know, he's just coming out with that book, Fasting Cancer, or it's an English edition now. That has been like fascinating to me in terms of like, first of all, doing fasting while I guess traditionally doing chemotherapy or something like that, or why fasting in general would be something that helps with disease. Do you have any thoughts on that in terms of like, because we're talking about treating cancer?
A whole other podcast we could do, a whole other hour and a half, whatever you want to do on that. Look, when you fast, which is removing caloric intake for a period of time, your body resets, it reboots itself. Okay, think about a Control-Alt-Shift on your or on with your hard restart of your computer. When you fast, that's what you're doing to your body. You're rebooting your gut microbiome, which lowers inflammation. You're rebooting your immune system, which you need to fight cancer. You're actually rebooting inflammation, your inflammatory cells. And so, you know, in a nutshell, and I'm oversimplifying what Walter Longo talks about, you know, fasting will actually do this kind of hard reset. Ketones, that's a whole other kind of metabolism. And, you know, that gets into the real nitty gritty with Thomas Seyfried and all these other people. Okay, that's also part of the equation. It's not the only part of the equation, but it's part of the equation as well. I don't think you can live very nicely if all you do is live a ketogenic life. So people, you know, that do practice ketogenesis and fasting in cancer patients, and you can find them on the internet. I mean, you know, there's one guy who is a friend of mine who I know. His name is JJ Trochon. Former Air France pilot, had kidney cancer, just had some surgery, never had any other treatment. He uses fasting and diet to actually, and lifestyle to manage his cancer. He's been like 14, 15 years without the cancer being a problem. It's really amazing. So this stuff works, but it's not mainstream. I mean, I think to say, forget about the regular treatments and just do ketogenesis or just fast, again, that's that oversimplification of just give me the formula. You know, and I'll do it. Yeah. And some people say, I'll do anything to avoid chemo. I know somebody right now who is saying, I don't want chemo. I'll do anything but chemo, but I want to live. You know, okay, first of all, some of the treatment, and, you know, she lumps every treatment under chemo. Okay, so I would say, you know, the God is in the details. And this is where, you know, you need to do your own research and realize and find good trusted sources to pick apart that combination of things that's going to personalize the treatment to you. And for, you know, many people, I think Walter Longo's program actually could be very, very beneficial. He's a very smart guy. I know him. And I think that he's one of those leaders that has worked out kind of a metabolic plan for overall health and specifically to fight cancer.
Well, hello. If you're looking to take control of your health and you want to use food as medicine to optimize your health, then I invite you to check out my Eat to Beat Disease course. I personally developed all the materials. It is fully online and packed with practical, science-based strategies and everyday tips that you can start using right away to boost your body's natural defenses that protect your health and fight disease. So whether you're wanting to prevent a disease or overcome one, or whether you just want to feel your best, my Eat to Beat Disease course has everything you need to make powerful changes in your life. Learn more about it by clicking the link below. Really important to understand that our immune system is also one of our body's health defenses. We got 5 health defenses. We talked about angiogenesis, and this is just scratching the tip of the iceberg. Immune system is another one of our health defenses. When I'm talking about health defenses, I'm talking about the things that guard our health. It's kind of like the lock on your door or your window that prevent, you know, bad guys from coming in. It's kind of like the fence you have around your yard. All right. It's like the guard dog, your alarm that you have in your house. Our immune system is like that. And when you actually have good, strong defenses, you're less likely to have invaders. Now, the invaders we think about, you mentioned, you know, cold and flu and all the other nasties that are out there around us. And by the way, we are surrounded by nasties. You know, as humans, we live on a planet that is
populated with germs. And we used to think, and listen, I went to medical school, right? So we were taught germs are bad, must wash hands, must get rid of germs. Actually, most of the bacteria that we encounter in our lives are good bacteria. They help us. If they're in our gut and they're healthy, they help build the lower inflammation to help build our immune system. And if we encounter them on the outside and they don't overwhelm us and they're not too nasty, they actually strengthen our immune system. Our immune system wants to have practice. Listen, this is why, like long before the pandemic, you and I have been both there. You're riding a bus, you're riding a subway, you're on a plane, you're at you're riding in a passenger in a taxi cab, and somebody's sneezing. Look, you don't necessarily get sick right away. And the reason you don't get sick right away or at all is because that little bit of bacteria or virus floating around trains your immune system. Your immune system goes, oh, yeah? Okay. We're going to actually protect against that. And that's one thing that we actually missed during the lockdown, during the pandemic. We isolated ourselves from normal germs. So now we're beginning to learn, some regular exposure to bacteria and viruses is probably really important for overall health. But how do we raise our shields? Well, this is where food as medicine research is really amazing. Remember I talked to you about those sulforaphanes that actually come from broccoli. All right.
Yeah, leafy greens.
Leafy greens. Okay. Sulforaphanes are this is the research has been done on broccoli sprouts specifically. So if I were to tell you about broccoli, you think about the treetops, the florets that you would get, right? You go to the freezer section of the grocery store, you pull out the florets, the jolly green whatevers, and they're all perfectly formed little florets, the little treetops. If you go to the farmer's market and you take a look at broccoli, it ain't no treetop. It's a whole trunk. It's the whole tree. Broccoli is mostly trunk and a little bit of treetop, right? It's like those pictures in Africa. You see all the elephants and lions prowling around the savannah. You got these gigantic trees growing with these big canopies. That's what broccoli is like. And the sulforaphanes are as much present in the stalk as it is in the treetops. So eat the stalk if you want. Actually, we did research on this. The stalk has twice as much of the good stuff. So this is the way of actually avoiding food waste. But let me tell you that the baby broccoli is a lot more potent than the grown-up broccoli. So whatever amount of, and this has been studied, whatever amount of good stuff, the sulforaphanes in the adult broccoli, the broccoli sprouts, which are 3 to 4 day old sprouts. You can see these in the produce section of the grocery store these days, broccoli sprouts. They have 100 times more sulforaphane in the little baby sprouts. All right. And they don't taste as bad. They're a lot easier to go down the hatch, and you can sprinkle them on salad. You can put them into a smoothie, real practical stuff. Okay. But you really get a big hit. There's much more bang for your buck if you're actually taking a look at it for the immune building stuff. So how do we know this works? This has been studied at the University of North Carolina, where researchers took young, healthy people, like we're talking about 20-year-olds, okay, who were getting a flu vaccine. In this case, they were getting a nasal vaccine to protect against the flu. It's a standard thing, nothing fancy. And they gave one group of people just a vaccine with a placebo drink. And then they gave another group of people the flu vaccine, but they gave them a smoothie made with broccoli sprouts. Okay. And what they found after a week is that the broccoli, it's a shake, actually, a broccoli shake that they made with 100 times more than adult broccoli of the sulforaphanes. They found that the immune system was ramped up much more powerfully if they had the vaccine plus the broccoli sprouts. So this isn't food in place of medicine. This is food amplifying the protection. So the vaccine gave you much more defense, but the broccoli sprouts by themselves and with the vaccine bumped up your immune response. How much did they bump it up? This is where, the research makes a difference, like quantitation, right? If you're balancing your checkbook or you're looking at your portfolio, you want to know, like, things are pretty good today. All right. How much better were they? Give me that number, right? I mean, this is what people want to know. Well, the immune improvement was 22 times if you actually had a tall cup of a broccoli shake, all right, in addition to your vaccine. So this makes a big difference in thinking about immune boosting. What's another immune booster?
Blueberries, and this has been studied in athletes. If you're like super fit, you're running ultra marathons, or if you're just like the average Joe and you're like, you know what, I gotta get in shape, I gotta work out, but you're really doing it maybe once or twice a week, or maybe even less. Turns out that blueberries can ramp up your immune system, and this has been studied in people that lead up to actually training. So, blueberries contain something called anthocyanins. Again, we know the good stuff. Leave it to me as a scientist, part of the scientific community. We can name it, we can spell it, we can say it, but most people don't need to actually understand it. But I think your listeners need to understand somebody's doing the work.
Right.
Anthocyanins in blueberries have been shown to improve immune function by about 30%. And if you do a really hard workout, a lot of people don't know this, but if you like go to the gym and really do like super cardio, all right, your immune system right afterwards, when you're in the shower, is actually going to plummet a little bit. It's the nature of actually hitting your muscles really hard. Now, it's good for you overall, but temporarily you've got a little bit of a dip that goes down for maybe a day or so, maybe less than a day. Then it comes right back up. Resilience, right? Blueberries prevent that dip. You eat blueberries before you work out, it just stays up. It protects you against that dip. So this is the little hack that I would encourage people that already work out to think about. You want to get more out of your workout, and you want to actually, prevent even the slightest crack in your shields. Have a couple blueberries before, and that's the dose, just 1 cup a day.
That's super interesting. I've heard it said that you kind of want to eat the rainbow, right? Like more multicolored fruits and vegetables. Would you say that's true for, when we're trying to make sure that we have our shield up, is that we're trying to get as much variety as possible, and then maybe focus on a few of these, like the blueberries and the broccoli, when we're trying to kind of boost the immune system?
Yeah, absolutely. I think eat the rainbow is sort of a let's make it as simple as possible so we don't have to even identify the foods. Everybody recognizes the rainbow's got a lot of different colors. And if that's, kind of your approach to it, I think that's fine. Go to the produce section or the farmer's market, or frankly, even the frozen section in the grocery store, and look for the fruits and vegetables that are actually different colored. I'm going to come back to the frozen part in 1 second.
Sure.
Some people might be surprised by it, but a lot of people buy frozen vegetables because they can't get really fresh vegetables all the time. And frozen is just fine because they are picked from the field and they're snap frozen, so all the polyphenols are locked in. All right. So actually, surprisingly, if you get frozen blueberries, they're just as good as the fresh blueberries, honestly. All right. Organic will have even more of the good stuff because organic plants have to work a little harder in the natural world without chemical pesticides to be able to protect themselves. And so their shields are up. And when their shields are up, they're making more of the sulforaphane, more of the anthocyanin in the case of blueberries. And guess what? We get the dividend. We get the upside of a plant that's growing in a more natural environment. So, but the rainbow, yeah, for sure. How do you do it? Look at the pepper section. Green peppers, red peppers, yellow peppers. They're beautiful. Mushrooms are brown, and broccoli, they say like leafy greens. All right. If you're an artist, and you know your color wheel, and there's something called Pantone colors, right? If you've ever painted your room, you're painting your house, you got to go to the Benjamin Moore or whatever your hardware store at the big box store, and you go to the paint section. Look at all those colors, right? And there's a wheel. Or there's like little tags that you can pick out with all those colors. If you look at green, you will notice that there's a whole repertoire of different types of green: dark green, light green, blue green, yellow green. And so even in the green vegetables, you have variety. You have and those varieties actually make a difference, because even within green vegetables, not all green is created equal. Green with a little bit of red, like green lettuces with a little red tinge. They have the anthocyanins. The same dye that gives blueberries blue makes lettuce a little bit red on the edges, on the fringes. And that's also good for your immune system. Hey, if you like that video, then you're going to love this one. Check it out.